While we treat diabetes by looking at the blood sugars every day, and we look forward to having our fasting blood sugars and postprandial blood sugars maintained. We also look at our HbA1c and the 3-month cycle being maintained very well, close to 6.5. All diabetes undergo change, which are progressive. And that's where a wake-up call today on diabetes and urology. So why is your urologist interested in your diabetes control? Very important for you to know that diabetes is a progressive phenomenon. While you control your blood sugars every day, you become a diabetic of 1 year or 10 years duration. As progression happens on the diabetic changes which happen around, there are various aspects which lead to changes which could be irreversible. And the irreversibility directly could be related to the end organ changes happening around. Which are the organs as a urologist I would be interested in as a uroenterologist? Number one, the kidneys. The kidneys undergo a change where there is something called as end-stage renal disease developed as a result of long-standing diabetes or uncontrolled diabetes. So uncontrolled diabetics sadly would lately go through a CKD or a chronic kidney disease, which could land up probably leaving them with a phenomena where the kidney functions gradually get deranged. So that progression of change happening in the nephrons as a result of long-standing diabetes, which is leading to a CKD, is probably the commonest cause of diabetes-related changes leading to kidney failure. So if we talk about kidney failure, a urologist would ask you whether you have diabetes or blood pressure or both, and these were uncontrolled for a very long time. So diabetes control is extremely important. Number one, it's not about the daily blood sugar, but it's about the phenomena of maintaining diabetes to such level, which is a quality of life issue, where you participate in a program of diabetes control. That means you're leading a healthy lifestyle. The lifestyle is all about drinking, eating, maintaining your health, and looking at the balance that you bring about by exercise, food habits, and whatever your diabetologist endocrinologist tells you. As a urologist, urologist is always interested in your urinary bladder. While urinary bladder has a mind of its own, it has the ability to relax and contract, relax and contract. Remember, those who are diabetic more than 10 to 20 years, that means long-standing diabetics, those who have been uncontrolled diabetes with a phenomena that was not stable because of the erratic diabetes control, they will end up with a situation where the bladder may have lesser sensations of the internal lining, and the outer lining or the contraction power may go gradually lesser and lesser. And what does it translate into? It translates into an ability of not being able to empty the bladder completely. That means your bladder could turn hypocontractile, hypotonic, atonic kind of a situation where the bladder may lose the sensation of the inner lining and lose the contraction power and relaxation of the outer lining. So it continues to stretch and stretch and stretch. It empties only when you push urine out. Rather than the bladder itself contracting and pushing urine out, you are pushing by a Valsalva or a Creed maneuver. That means you push urine out of your body rather than the bladder pushing out of your body. So that important mechanism where the bladder's ability to relax and contract and sense gradually goes down could happen in all people who are diabetics or very long standing or diabetics or uncontrolled. And that's a phenomena where the residual volume stays high. So imagine somebody is in his 50s, 60s, and 70s who's got diabetes from 10 to 20 years, long-standing diabetes of uncontrolled origin, as a result of which the bladder does not empty completely. A sonography done shows a prostatic enlargement if he's a male, or a female with no prostate, but the urine doesn't empty completely. The residual volume measured on your ultrasound report could be 100 ml, 200 ml, or even 300 ml. That means the residual volume, which normally should be between 0 to 50 ml, is high. When we ask you questions, you say, my urine does not come out well. My urine doesn't flow well. I pass urine with difficulty. I have to strain. It's a stop and start kind of urination, and the bladder doesn't empty completely. Which means that the very mechanism which senses the urine is on the lesser side. The bladder may be too full. When the bladder is full and whatever sensations you get, which could not be a streamlined sensation, you empty your bladder with a power, which could be partly bladder's contraction and a more assistance by a tummy pushing it. So what does it mean? You're adjusting every day of your life to changes happening internally and very gradually. This is without your knowledge and without your notice. That change where the bladder undergoes a progressive decay in its sensation and contraction power, leading to an hypotonic bladder or a hypocontractile bladder where the bladder cannot push urine out, and finally leads to an underactive bladder where the bladder cannot act value addition of its capability of passing urine after storing urine goes down. It does not fulfill that function of emptying urine. And these hypocontractile bladders or underactive bladders happen to be a dilemma in medical science. It is difficult to empty these bladders even with the best of medication many a times. If you're an elderly gentleman, if your prostate is also enlarged, your urologist looks at a cystoscopy, maybe clears the prostate, Otherwise, you'll end up with a urinary catheter and high residual volume, and sadly with recurrent urinary tract infections. Women who are diabetic of long standing, apart from getting recurrent urinary infection, which could happen as a result of the diabetes and immunosuppressed status, could also land up with a situation where the bladder control holds a lot of urine around. Again, the same hypotonicity of the bladder and the urine doesn't empty. So important about the bladder that the bladder can go to an end-stage bladder called underactive bladder completely. If you are not aware that the diabetes control is a regular phenomena, is a lifestyle change that you need to bring about with your doctor assisting your blood sugar levels. Very, very important. As a result of the diabetes screening which happens around, your diabetologist will ask you to screen your eyes because there's a diabetic retinopathy, which is a long-term change happening there. He looks at your blood sugar levels. He looks at your kidneys levels by checking creatinine and ultrasounds. As a urologist, we look at your urinary bladder. We ask you to do a uroflowmetry, pass urine in a computerized toilet. Very young diabetics with no prostate issues and women who obviously have no prostate and no major changes happening in the urinary passage could still have the bladder hypotonic or hypocontractile, and they may not empty the bladder completely. So it is a wake-up call that diabetes control is a regular affair. It's a part of our life. Men go through phenomena of erectile dysfunction. Erectile dysfunction in diabetics is irreversible. In other words, there's a massive stage migration which happens in diabetics compared to non-diabetics. Young men go through erectile problem, erectile dysfunction. They come and see us at the Coquitlam Dhirubhai Ambani, where all 6 days a week in the outpatient department, we see young men, young couples with erectile dysfunction. One side, we see people with refractory erectile dysfunction, and we see diabetics with erectile dysfunction which has not been treated. Attempt at medical management and doing jigsaw of combination and changes have only given that much result, which doesn't translate into effective, capable erections to be able to perform with the partner in the bed. And that's a progressive phenomenon which is happening gracefully with age. That happening and compounded by poor diabetes control is a result of something called as diabetic microangiopathy, diabetic neuropathy, where are those changes which affect the nerves and the blood vessels there. The erection process is lost. The process is gradual. These men complain of no morning erections, no erections while passing urine, no erections during spontaneous or stimulated capabilities, as a result of which they would land up with such stage migrated phenomena where medicines won't work in them. And that's where many a times diabetic patients get a cure only by penile processes. All men who have been diabetic for long standing, all men who have got erectile dysfunction, if they've attempted medication and not improved and not recovered and regenerated, would actually require a penile processes, which we continue doing for men who are motivated and want to continue doing a good work with their partners on the bed. So erectile dysfunction in a common man and a normal man compared to a diabetic is completely different. The stage migration is amazing. The microangiopathy and the neuropathy, which sets into the very important capable organ of the corpora cavernosa of the penis, doesn't let the erection happen around. The flow of blood, which brings about erectile capacity, completely goes away, as a result of which you may not get erection at all. Penile processes could be your cure and could be your treatment in such situation. So friends, while diabetes brings about changes to everybody, diabetes also brings about changes to men who are uncircumcised. Men who are not been circumcised and whose prepuce or skin is still there, that in uncontrolled diabetics may actually get inflamed and infected again and again, developing recurrent balanoposthitis, an infection where you develop an acquired phimosis, a phimosis or tightening of the skin which cannot be retracted back, and there's a recurrent tears and trauma happening around, and there's a bleeding from there, and any kind of a situation where you have an erection and erection worsens actually is a trouble. So as a result of one side not getting a good erection, other side you develop recurrent urinary infection or recurrent burning in the tip of the penis, or the skin of the penis is red, inflamed, tight, discharging pus, and probably cannot be pulled back. Progressively and gradually being a diabetic is something which you need to work on. So men and women go through changes in diabetes, not only in the blood sugar levels, which the diabetologist continues to control them and works very hard, bringing the quality of life into the perimeter of discipline. It is important for us to know that there are organs which can go through end organ change. Urinary bladder to a urologist is an important organ where the emptying mechanism and the sensations may go along, and that is something we need to wake up about. Number two, the erectile process may go down completely and that would not recover again. That would require a penile processes if medicines don't work in you. Number three, the kidney undergoes an end-stage renal disease, but then the therapy would only be a kidney transplant, which is what from the platforms at Coquitlam Hospital we keep talking about as a uronephro team, and make more and more people aware that if you are end-stage renal disease, dialysis is only a stopgap therapy. It is transplant which will bring you the cure that you're aiming for and keep you off the machines and bring you to a fuller life. So at the end of it, when this kind of a situation comes in, we got to wake up and